On this segment of Citrus Today, we're going to talk a little bit about exercise and heart health. And to help us do that, from Citrus Cardiology Consultants, this is Dr. Nishant Nerella. And we're glad to have you on the show today.
Well, thank you. Thank you for having me, Mr. Miller. It's my pleasure to be here. You know, it's a great opportunity to talk about a really very important topic.
Well, important indeed, as many of us know through experience. When you have a heart attack or a stroke, it's a very bad thing. If we can avoid that, then we need to do everything possible.
Absolutely.
And one of the big things that we encourage people to do, and I know you are all the time talking about it, is exercise and the benefits of that versus a sedentary lifestyle.
Absolutely. That's a great start to this conversation, Mr. Miller, because the sedentary life has been shown to increase the risk of having a heart attack or a stroke, vascular complications we call, by 50 times. Compared to a person who exercises 5 times a week.
Wow.
So it's a tremendous risk factor. It's one of the, we always, when we talk about risk factors, we always think about, what is your cholesterol, what is your, is your diabetes control and all that. But now we have this lifestyle, with this lifestyle, which is actually one of the biggest risk factors, which not many people stress on.
Because we live in a country where a lot of people watch TV more than ever before, they're on their phones, texting and doing different things, Facebook, Twitter and all, we do become sedentary, less exercise conscious.
Absolutely.
And when people think of exercise, they think of, being in that gym and pumping iron and all that stuff, but really, you need to start off moderately, right?
Absolutely. So basically, the kind of exercise that really improves heart health and vascular health is something called a modest intensity exercise. When we call modest, by definition, what it means is that any exercise which is equivalent to walking briskly at 3 to 4 miles per hour, and 3 to 4 miles per hour, sometimes we have difficulty calculating that. A lot of my patients are. I tell them that go on and exercise, and at the peak exercise, you should be able to talk, but you should not be able to sing.
That's a very good measure of how to do it.
Right. So if you're worried about numbers, calories, exercise, heart rate, it's complicated. You can do this. Keep on doing exercise at brisk level. You should be able to talk, but you should not be able to sing. That is the perfect exercise. And that you do it for 30 minutes a day, and most days of the week, like 5 to 7 days. So that is actually the exercise which is. It's
an aerobic type exercise.
Absolutely. Walking, equivalent to walking. You could, if you like, swimming, that's fine. If you like cycling, fine. So anything equivalent to that. That is actually a benchmark, what you want to achieve. But anything equivalent to that, 3 to 4 miles per hour speed, whatever you walk, that is equivalent, whatever is equivalent.
Very true. I see a lot of people nowadays bicycling. That's a new fad that's, a great one. Probably the easiest exercise, though, as you point out, is walking. Everybody can do it. Just get out there a little bit at a time, increase each week the amount of distance that you go, or picking up your pace, your speed.
Absolutely.
And you'll gradually get there. It's not something that you do overnight, right?
Absolutely. And that's a great point you said, Mr. Miller, because when you are starting, you always want to start slow.
Yes.
And if you have some heart condition or elderly above 45 with multiple problems, you always consult your physician before starting. Take their advice how to go about. But I always tell my patients, start slow, okay, and always ramp up slowly. Take a week at a time. But ultimately, your goal is to get to 30 minutes 5 times a week, and every step beyond that is more beneficial, not less. And once you get there, I'm happy as a doctor. When you come to my office and say that, I say, are you walking 30 minutes, 5 minutes? Okay, that's all. My questions end on exercise there. I'm happy as far as I'm concerned there.
Now, are there some other measures that you look at that kind of set a benchmark where the patients are doing well? Blood pressure, pulse rate, those kind of things?
Of course. I mean, we look at multiple things, like, in a visit, right from my MA checking the blood pressure and all that, to me looking at the labs and a physical exam, we look at blood pressure, we look at the heart rate, we look at their cholesterol numbers and all this. And it's a great thing because all these factors are also influenced by exercise. And we noted that, the studies have clearly proven that blood pressure is better, glucose tolerance in a diabetics is better. It's preventive, not only diabetics, heart disease, but also some of the cancers. So all these things are,
they work together.
Yeah, intertwined, so to speak. And exercise is a very, very important part of that.
There you go. And today we've got probably more than ever before equipment, gadgets to help us with exercising, right?
Absolutely, and that is actually for the last 1 year, I've been talking to my patients more about that. Since the new iPhones and the Androids and all have pedometers there, and I'm showing them, and in fact, I myself do it on, me and see. Well, in the beginning, when I was looking at my pedometer level, I was actually classified as sedentary myself. As a doctor, as a heart doctor, I was sedentary, and I was shocked because anyone less than 5,000 feet, 5,000 steps, if you take, is considered sedentary for most standards. You have to get up to 10,000 steps a day, and that's when the benefits of exercise are there. And I looked at it and I was like shocked, and I keep on telling my patients, I show them this is my log, And I'm not there, but I'm trying to get there. And it's easy if you put your phone in your pocket and just walk around, and it keeps your step log and it shows to you. And so now you have something you can track it. And it's amazing. Yeah.
And today with players, MP3 players and that kind of thing, and smartphones, you can download music that gets you exercising at the right pace, right?
That's a great point because it should never be a burden. It should be fun. Anything, if you do it like fun, it lasts and you keep on doing it, not like a burden. And if you love music, if you want to listen to music, go with that.
Right.
It's whatever you like. But the point is, you should get up and one step at a time, we can save our hearts.
There you go. Well, Dr. Nerella, thank you very much for joining us on the show. Great tips. And again, the folks at Citrus Cardiology Consultants can give you a lot of great information. Do you have a website they can check out too?
citruscardiology.org.
There you go. Very easy to find. Stay with us, everybody, because we have more to come on Citrus Today right after this.